Hello, good evening, everybody. Hi, we are here again on our Facebook Live on Nursing Prioritization and Delegation. So for tonight, we have a few questions that I have prepared for you to improve your skills in answering questions regarding prioritization and delegation, of course. But before anything else, as usual, I would like to introduce myself. My name is Mr. Alan Matus, and I am nursing faculty. Also, of course, a nurse educator for more than 25 years, I guess. And also, I published a book in Amazon. The name of the book is Simple, Fast, and Easy NCLEX Review. So if you are a student who wants an immediate resource to review your nursing content, straight to the point discussions, then this will be the book. So the Simple, Fast, and Easy NCLEX Review that I have in Amazon. So grab your copies, everyone, and you can also buy this in other websites like the Barnes and Noble as well. So if you need more information about the book, let me know, everybody. Okay. So at this time, as what I have said, I'm also a nursing faculty. I help students pass their license, their nursing program, and then of course I'm an NCLEX specialist. I help students pass their NCLEX examination as well. So in September 30, 2021, I'll be joining one of the biggest events about NCLEX, which is the annual NCLEX conference by the National Council for State Boards of Nursing, which is the main agency or organization that develops the examination. So we will be hearing updates about NCLEX, especially the focus of which is the upcoming implementation in 2023 of the new format of the NCLEX, which is the next generation or next gen NCLEX exam format. So I'll be sharing any information about that conference to you guys. After the conference, I'll be sharing that with you. Okay. So also before we start, I would like to welcome some of the people for tonight who have joined us. So we have a lot of people joining us. Thank you very much, everyone. So we have Chelye, Mia Morales, Shane Nakpil, giving you all shout out, everyone. Arlene Tameta, Gigi, Gian Torres. Hi, Gian, how are you? Kadiato Trawali, Aderon K. Ajayi, Gladys Bine or Bine, Shane, also, hi Fernando Ray, hi my student, hi Fernando Ray, also Abigail, Chico, and Miriam Agpaua. So thank you very much, guys, for being here and for tuning in. And of course, thank you very much also for sharing this Facebook Live to your classmates as well. Before anything else as well, I would like to share this very special testimony of a student about our program. So the name of the student is Jay. So Jay recommended the program, and he said, I would like to say thank you to Sir Alan. So long story short, I graduated from a VN program 11 years ago, and last week I took my NCLEX for the first time and found out I passed. Back in 2019, I was lucky enough to find Matus Nursing Review in Long Beach. Sir Alan Matus was a familiar face. He was one of the instructors from the school I graduated from more than a decade ago. Sir Alan is more than just an instructor to all of his students. The strategies, the fun, the knowledge, and friendship you'll get from this review class is something very special. I am hoping every single one of your students pass the boards, Sir Alan. The Kindle version of your book was very helpful to me as well. To everyone else reading this, focus. Surround yourself with positivity. Remember that graduating from school itself makes us deserving to be nurses. It's only a matter of proving the board of nursing that we deserve to be nurses. So, thank you very much, guys. And congratulations to Jay for passing the NCLEX-PN examination and for this testimonial, of course. Recently, also, we had a sale, and it ended, I think, September 7. But some people have been messaging us if the sale is still ongoing. So we have decided that we want to extend the sale for the Labor Day special. So we have extended the Labor Day sale actually from September 9 to 12. So if you still want to grab our usual sale, which is 50% off for the self-study program, so instead of $499, you only have $249.50. That would be unlimited access to our review program and to all of my videos. coupon code there, so make sure that you put a coupon code so that you get your discount. And also 30% off for our NCLEX workbook, which is $66 only instead of 94 and 50. Okay, so next we have, of course, an announcement in October 16 to December 18, 2021, live comprehensive NCLEX review webinar. It's an interactive online NCLEX review to master your nursing core content. So if you're a student who you just graduated from a nursing program and you feel like you really want to review your nursing content, so this is the review for you. So we'll be discussing all the topics that you need to know about the NCLEX, okay? To prepare you, especially in the NCLEX, mastering the topics to make sure that you can use them for your critical thinking. A lot of students have been asking me as well if I have a face-to-face class. The schedule is October 16. If there is, we will make a special announcement if we have a face-to-face class. At this time, we are reviewing the protocols or the situation about COVID. If there is, probably within this week, we will announce if we have a live class, which will be probably in Long Beach, California. I really want to do a live class because I like meeting my students in the classroom as well. So keep posted for announcement regarding the face-to-face class. But as of this time, it's going to be a webinar. Now, if we have a face-to-face class, it's going to be combined with the webinar as well. So students can join us virtually via the webinar. So we have the face-to-face students, and then also at the same time, we have the webinar students together in the same class, and that would be awesome. All right, so let me check some questions in the comment section. Okay, so let's see. So thank you very much for sharing this. Okay, so we have okay, thanks Gigi for sharing. Okay, we also have Robbie Arenas. Okay, hi G, and thanks for responding. Okay, so as usual, so we have our free 90-day online access NCLEX review. To whoever is giving a comment tonight, we'll be drawing at the end of the program, and then we will announce in the program who wins the 90-day online access NCLEX review. And one great news also for everyone, okay, starting next month, we will have a new platform or software for our quizzes. So the quizzes will be having a different look, okay? So hopefully, or you were able to receive the emails that we sent out this week, that by before October, probably will be launching the new format of the quizzes in the online academy. And so far it really looks good, and I hope that you will enjoy the new format of the quizzes. Okay, all right. And of course, everybody, I would like to request everyone to share this program or session to your classmates or to your friends. And if you're watching on YouTube as well, can you please click subscribe so that we can help more other nurses, okay, watch this video so that they can pass their NCLEX. So thank you very much, guys. Okay, so before anything else as well, I would like to share with everyone a method that I have developed recently and shared with students, instructing them or advising them or giving them a recommendation on how to read the questions. To read the questions and answer the questions, especially in the NCLEX, you really have to be systematic in answering the questions. What are the most important elements in order to arrive at the correct answer in the NCLEX? So remember my method, which is the READ method, or REEAD method. So let's discuss this method, and I hope that you can apply this whenever you are taking your examination or when you are doing practice questions. And I will tell you that this is a method that you can see all over the place, but I put it in an acronym so that you can remember them, okay? But these are generally the recommendations when taking examination. That's what I mean. So the method is READ method, everyone. So R means that when you read a question, number one, you really have to read and understand the situation. Read and understand the stem. You really have to understand the stem. And then letter E next is expect. Find out what you think is a possible answer before you even read the distractors. Always remember that the distractors will sound nice. The distractors have one purpose, which is to distract you and for you to pick the wrong answer. So it's really very important for you to know, to have an idea before you look even at the options. So before you look at the options, expect what will be probably the answer is. So that would be letter E. What is going to be your nursing action? And you really understand what the question is. And always remember the distractors are there to distract you. They will sound nice. They will be familiar words, and you will have a bias when picking the answer. Why? Because you did not understand the question. So it's very important for you to understand the question, expect what possibly is the answer, so that you don't get swayed at the distractors. Now, letter E is eliminate. I always tell my students that when you choose answers or choices, when you choose the best answer, always eliminate, because the more that you eliminate options, the more that you can arrive at the correct answer. Especially if you're able to bring down the choices into two choices, and then you have to choose the best answer. So always eliminate, and eliminate the obviously wrong choices. Obviously wrong choices. Now, some students will ask me, Sir Alan, what if I have two choices left and I don't really know what the answer is? Well, the golden rule is, if you don't know which one to choose between the two choices that are remaining, then you go back to the stem, you go back to the question. Now find out, get some clues, and find out what do you think is going to be the best answer between the two. Okay? And then of course, letter A is to pick your answer, and the answer should always be the best answer and the correct answer. And last, letter D is to double check your answer before you click submit. So kind of like go back a little bit to the question again and just double check, making sure that the answer that you picked really answers what the question is asking. Okay? So after choosing the final answer, review the stem again to make sure that you're answering what the question is asking, which is the most important question, most important strategy in the NCLEX. I'm gonna give you a very good example. For example, if you're giving pyridium or phenazopyridine to your patient, we all know that phenazopyridine or pyridium is a medication to manage or treat the pain if you have urinary tract infection. Phenazopyridine, pyridium, that is for urinary tract infection to reduce the pain. So if you're going to be asked, how will you know that phenazopyridine or pyridium is effective for your patient who is having a UTI? Then the answer definitely is that the pain will be decreased, or the pain will disappear, or will be minimized or reduced. However, one side effect of phenazopyridine or pyridium is the discoloration of urine, which is orange red. Discoloration of urine. Now, discoloration of urine does not necessarily mean that the medication is effective. That is a harmless side effect of the medication. So you have to answer what the question is asking. The question is asking you for the effectiveness of pyridium or phenazopyridine. How will you know it's effective? Then the answer is the reduction of pain, and not necessarily the discoloration of urine. So just remember that. Don't get too excited when you see an option because it looks familiar. You really have to read the question and really understand what the question is asking. Okay? All right. So everybody, I would like to ask you guys, are you ready for the first question for tonight on prioritization? Okay, let's see. Okay, so shout out from which country also are you coming from, everyone, so that we can give you a shout out. Okay, can you please put that in the comment section? I can see right now that Abigail Chico is from Zambia, so we are definitely international, everyone. Okay, international. Okay, so Kim Barnil, thank you also for being here tonight. One of my great students as well, Kim. Thank you for being here. So let's have the first question, everybody. Without further ado, let's go straight to the point. So number one, we have the NCLEX challenge question. So the nurse cares for several clients in the medical surgical unit. Which of the following clients will require an order of aluminum hydroxide or ampho gel? A. The 24-year-old client with hypoparathyroidism who has a calcium level of 7 milligrams per deciliter. B. The 55-year-old client with emphysema who has a pH of 7.33 and a PaCO2 47 millimeters of mercury. C. The 43-year-old client who has multifocal premature ventricular contractions after a myocardial infarction. Or D. The 32-year-old client who develops constipation after receiving high doses of hydromorphone. Again, I will read the question. The nurse cares for several clients in the medical surgical nursing unit. Which of the following clients will require an order of aluminum hydroxide or ampho gel? A. The 24-year-old client with hypoparathyroidism who has a calcium level of 7 milligrams per deciliter. B. The 55-year-old client with emphysema who has a pH of 7.33 and a PaCO2 47 millimeters of mercury. C. The 43-year-old client who has multifocal premature ventricular contractions after a myocardial infarction. Or D. The 32-year-old client who develops constipation after receiving high doses of hydromorphone. And I would like to give a shout out to the following students. We also have Gigi from California. Chelly is from New Zealand. Wow, that's awesome. Chi from New Zealand. Jane Leoren is from Saipan. Cadiato, hi Cadiato, you're from New Jersey. Okay. All right, from San Francisco, hi Gina, how are you doing? Okay, I'm giving you a shout out to my friend. Also, who else do we have? Okay, so put your answers, everyone. What do you think is the best answer, A, B, C, or D? Okay, anyone can put your answer. From Arkansas is Joyce Flores is from Arkansas. Okay, what do you think is the answer? Who needs aluminum hydroxide or ampho gel? And you can also put your rationale for the answer. This question is a very important question, especially a very important concept to remember about ampho gel. I always touch this in the class. The purpose of giving ampho gel to your patient. Well, aluminum hydroxide. Okay. And then can you give your rationale as well why you answered A, B, C, or D? Let's try to find out what's the reason why you answered A, B, C, or D. Now, ampho gel is a very important medication, especially for patients with kidney problems. We give you ampho gel, and I usually discuss also ampho gel in renal failure. Okay. All right, so let's discuss the answer to this question, everyone. Okay, so the answer to this question, everybody, let's see who gets the right answer to this question. The answer, everyone, is going to be letter A. All right, so letter A is the answer, everyone. Now, why is letter A the answer? Number one, aluminum hydroxide is an antacid. We all know it's an antacid. It's for peptic ulcer. However, aluminum hydroxide or ampho gel, by the word it says faux gel, faux ampho gel. This is a medication that can lower down. A side effect is to lower down the level of phosphorus or phosphates. Okay, it lowers down the level of phosphorus and phosphates. And remember that when your phosphorus is low, calcium goes up. Remember that. When phosphorus is low, calcium goes up. Now for letter A, your calcium level is only 7. The normal calcium level generally in most books is around 8.5 to 10. So in letter A, you have hypocalcemia. This patient is having hypoparathyroidism, which is characterized by low calcium levels, of course. So in order to elevate the level of calcium, you have to lower down the level of phosphorus. We have learned that in school that your calcium and phosphorus are inversely related. Whenever your phosphorus is low, your calcium goes up. Whenever your phosphorus is high, your calcium is low. Can you remember that, guys? The relationship between your calcium and your phosphorus. So again, just to clarify everybody, letter A is the answer because lowering down the level of your phosphorus will elevate the level of your calcium in the blood. And that's the reason why we're giving Ampogel to this patient in order to lower down the level of phosphorus and increase the calcium. Now, let's see. Letter B is not the answer. Letter B is respiratory acidosis. Aluminum hydroxide has nothing to do with respiratory acidosis or letter B. Now, letter C, aluminum hydroxide has nothing to do with your premature ventricular contractions. And letter D, constipation. Aluminum hydroxide, a side effect of that, if you know this, is aluminum hydroxide causes constipation, right? Magnesium hydroxide causes diarrhea. So aluminum hydroxide is not given to someone with constipation because constipation is a side effect of this antacid. Remember that. We teach that in the class. Okay? So that's why the answer is going to be letter A, everyone. Okay? So listen again to the rationale, okay, when you listen again to the video, when you watch the video. So let's go to the second question, everybody. Very important as well. Okay. So who got the question right? Okay, I think the answer was A. So hopefully that next time you remember the concept about aluminum hydroxide, everyone, okay? Now, number 2, the nurse receives the order, which is 10 units intravenous bolus of regular insulin with 50 ml of D50 water stat, or as soon as possible. This order is indicated to which client? A, the 55-year-old client with end-stage renal disease and has a potassium level of 6. Letter B, the 41-year-old client with type 1 diabetes mellitus who has acute confusion, tremors, and cold clammy skin. C, the 53-year-old client who has hypokalemia and hypernatremia due to diabetes insipidus. Letter D, the 29-year-old client who develops metabolic alkalosis after 3 episodes of nausea and vomiting. Let's read the question again. The nurse receives the order, 10 units intravenous bolus of regular insulin with 50 ml of D50 water stat. This order is indicated to which client? So we presume that this question is for the NCLEX-RN because this is intravenous fluids. Okay. So A, the 55-year-old client with end-stage renal disease and has potassium level of 6. B, the 41-year-old client with type 1 diabetes mellitus who has acute confusion, tremors, and cold clammy skin. C, the 53-year-old client who has hypokalemia and hypernatremia due to diabetes insipidus. And letter D, the 29-year-old client who develops metabolic alkalosis after 3 episodes of nausea and vomiting. So put your answer, everyone, and then the rationale as well. And just to let everybody know as well, I'm writing another book at this time. The next book that I will have will be about prioritization delegation. So all of the questions that we have in this Facebook Live, please give me your feedback in the comment section, okay? All the questions that we have in this Facebook Live will be in the book, and there will be rational. So if you're a student and you want to read the question instead of watching, then you can read the questions in the book. So the book is probably coming out by next year. So we're finishing it up. So all the questions, it's almost 260 questions in the Facebook Live that will be in the book. Okay, so you'll be mastering your nursing prioritization and delegation. Your prioritization delegation is not going away because it's part of the test plan. So even if you have the new format of the NCLEX in 2023, you will still have questions on delegation prioritization because it's in the test plan. Okay, so everyone, what's the answer? So review the concept about giving insulin and D50% or D50 water as soon as possible. What is the reason for that? I would tell you that this is a concept a lot of students usually may have a problem answering with. Okay, but then I want you to give the rationale. Why did you pick A, B, C, and D? All of this or most of this are serious conditions, but you have to answer what the question is asking. The question is asking you, for which patient are you going to give regular insulin with 50 ml of D50 water? Why? Is it for A, is it for B, is it for C, or for D? That's the question. You have to answer what the question is asking. So the answer to this question, everyone, let's see. Okay, the answer, K, is going to be letter A, everyone. Okay, A is going to be the answer for this. Now, why is letter A the answer? Now, we're giving regular insulin with 50 ml of D50 water stat. You have to remember that one treatment for hyperkalemia is giving insulin. Go back to your physiology. When you give insulin to your patient, it puts the potassium inside the cell. It transfers the potassium inside the cell, and that lowers the level of potassium in your blood. So that's one way to lower down the level of potassium by giving insulin together with your D50% water. Okay, dextrose 50%. So that's the answer, everyone. Now, another question. What is another way to lower down the level of potassium? That is by giving what drug? Your kayaksalate, or your sodium polystyrene sulfonate. So kayaksalate is another way to lower down the level of potassium. And another way to lower down the level of potassium is to give your potassium wasting diuretic, which is your furosemide or Lasix. Okay, furosemide or Lasix. So letter A is the answer. It's an emergency, of course, or it's a critical value. It's 6. So we need to lower that down, but it is the one that answers the question. You know why we have to give insulin? Because it pushes the potassium into the cells. Very good. Now, letter B is also an emergency. However, letter B, we don't give insulin to letter B. Letter B is hypoglycemia already. So the last thing we want to do is to give regular insulin. Am I right? So letter B, we only give D50% or dextrose 50% IV to someone with hypoglycemia, but we don't give insulin. So letter B is wrong. Okay? Now letter C, that's not the answer. And of course, letter D is not the answer as well. Okay? So the answer, everyone, is going to be letter A. I hope that everybody got the answer for that. So always remember that for hyperkalemia, one treatment for hyperkalemia, everybody, is going to be giving your patient insulin with the 50%. All right? Okay, so that's all, guys. Now let's go to your delegation question for tonight. The delegation question seems to be easy in the NCLEX. So, the registered nurse is teamed up with the unlicensed assistive personnel to care for a client who is receiving after coronary bypass graft surgery or CABG. Now, which of the following tasks can be delegated to the UAP? Select all that apply. A. Instruct the client on deep breathing exercises. B. Administer an enema. C. Provide mouth care. D. Empty the Foley catheter bag. E. Give a bolus tube feeding. Or letter F. Reinforce a surgical dressing. Again, the registered nurse is teamed up with the unlicensed assisted personnel or UAP to care for a client who is recovering after coronary artery bypass graft surgery. Okay, so which of the following tasks can be delegated to the UAP? Select all that apply. Is it A, instruct the client on deep breathing exercises, B, administer an enema, letter C, provide mouth care, D, empty the Foley catheter bag, letter E, give a bolus tube feeding, or letter F, okay, reinforce the surgical dressing. Okay, so we have a few answers already. Okay. All right, so what's the answer, everyone, to this question? So we always go back and practice on delegation because I think that at some point, some of you may have forgotten the principles about delegation. Okay? I would like to welcome Yoshika Singh, Teresa, Momo, Mars, Hinomra, Jane Lauren also. We also have Kay, Catlea, Espiritu for coming over for tonight. Okay? So let's see the answer, everyone. It seems like everybody has given their answer. It seems to be an easy question. Okay? But you do have these questions in NCLEX. So the answer to this question, everyone, is going to be, let's see, what is the answer? All right, so the answer is going to be letters C and D only. Okay, I think most of you got it right. Congratulations, guys. Okay, now C and D, because mouth care is within the scope of practice of the UAP. Letter D is empty the Foley catheter bag also. And then always remember also that when we delegate a patient to a UAP, we have to make sure that that patient is stable. Okay, now letter A, instruction is teaching. So teaching, letter A, that's for the RN. B, enema, that's for a licensed nurse. Letter E, bolus tube feeding, that's for a licensed nurse. And letter F, reinforcing the surgical dressing, that's for a licensed nurse as well. So the answer is going to be letter C, and then of course letter D. Okay, so don't forget that RNs do not delegate EAT, evaluation, assessment, and teaching. All right, so let's go to the last question for tonight, everyone. Okay, and although we only have 4 questions for tonight, guys, always remember that we have lots of questions in YouTube. We almost have 200 questions now with all of these videos. This is session 63. So session 63. So we have a lot of sessions already. So if you need more questions, and if you haven't been joining our Facebook Live, you can always go to YouTube and watch the videos as well. Okay. So let's proceed to our last question for tonight, everyone. Okay. Which of the following tasks are appropriate to delegate to the licensed practical nurse when caring for a client in the medical surgical unit? Select all that apply. A, collect midstream urine specimen. B, update the fall prevention care plan. C, orient the client to unit procedures. D, complete the Braden scale form. E, obtain finger stick blood glucose level. Or F, apply fentanyl patch. Fentanyl, your branding for fentanyl is the Duragesic patch, okay, or Duragesic. So again, which of the following tasks are appropriate to delegate to the licensed practical nurse or LPN when caring for a client in the medical surgical unit? Select all that apply. A, collect midstream urine specimen. B, update the fall prevention care plan. C, orient the client to unit procedures. D, complete the Braden scale form. E, obtain finger stick blood glucose level. Or letter F, apply fentanyl patch. So give me your answers, everybody. Okay, so let's see if anybody knows the scope of practice of the LPN. Scope of practice of the LPN. So we have different answers from different students. That's a little bit interesting. So if you're an international graduate, it's very important for you to understand the scope of practice of the LPN. At this time, I'm a nursing faculty of a vocational nursing program. And also, I have been working in a hospital also and skilled nursing facility. So I work together with LPNs. So what is their scope of practice generally? All right, so let's see. Okay, I can see that we have new people joining us tonight. So let's see, everyone. Very important for you to know. All right, so the answer to the question, everybody, is going to be letter A, letter E, and then of course letter F. Okay, A, E, and F. So it's within the scope of practice of the LPN to collect urine specimen. Remember that, midstream urine specimen. Letter E, obtain finger stick blood glucose level, of course. And letter F, apply fentanyl patch. Fentanyl is an opioid, it is a narcotic, and LPNs can apply or can give opioid medications or narcotics. The only time that LPNs gonna give any medication is if the medication is intravenous. That's for the RN. Okay, intravenous is for RN, but any injections that would be for LPN. They can inject medication. They can give also oral medication. Your letter B, update the full prevention care plan. We have discussed that many times in this session that anything to do with a care plan, the owner of the care plan is the registered nurse. She owns the care plan, she updates the care plan, she develops the care plan. The LPN can just give suggestions on interventions or in the creation of the test plan, just to give recommendation. Now, and also the LPN can carry out some aspects of the care plan as well. Your letter C, orient the client to unit procedure, that is teaching, so that would be under your RN scope of practice. Letter D, complete the Braden scale form. The Braden scale form is an assessment form for determining the risk for pressure or ulcers or pressure injury. So letter D is an assessment, and assessment is always for the RN. Okay, and then of course that's your ACD. So just BCD. So AEF is the answer. And just remember again that RNs do not delegate EAT, evaluation, assessment, and teaching. So remember that, everyone. Okay? All right. So that's it, everybody, for tonight. Before I end the session, of course, I would like to share with you, if you have any questions about our program, you can visit Matus Nursing Review and in the matusnursingreview.com, and then you can click online NCLEX review or our program. So generally, when you select our self-study program, these are all the features. Okay, so we have interactive core content review. We have highly organized and up-to-date task plan-based curriculum. We have the NCLEX Success Workbook. You can see that in the photo. Study plan checklist, hundreds of end of lessons NCLEX quizzes. Final NCLEX predictor assessment exams. We have two of those. All of these recordings will be in the online academy as well. And we also have Facebook discussion groups with questions. So, and then if you have any questions about the program, you can just email us at info@matusnursingreview.com, or you can also visit matusnursingreview.com. And also, of course, to our loyal fans, okay, to our loyal students, our super fans. So if you want to be part of our tribe, we have all the products online as well. You can visit matusnursingreview.com and click promotional products. And you will see we have different designs of masks, also sweaters, and also water bottle as well. So we have tons of products, guys. And I would be very happy to see you or having our products. And also, if you have any pictures, you can send them to us. And for last time, our winner for the 90-day online NCLEX Academy raffle was Dali Monty. So congratulations, Dali, for winning the 90-day online NCLEX Academy. So I hope you have reached out to us and then you have claimed your prize. So everyone, thank you very much. If you have any questions, you can send us a message directly in the messenger. Okay. Or you can also send us an email, and hopefully next week I'll see you again. So